As I stated, first treatment takes much long time and cost more for our clients. But at the time of initial evaluation is very important not only to realize and to create treatment plan that could be done only after initial evaluation, and I'll do this in a second. Yeah, but of course, very important in the beginning to take history, spatial questionnaire history, what kind of medication person taking, names of doctors. It could be optional, but I like sometimes to talk to doctor if there is any questions. When we're taking this history, it's important for many reasons. We also can determine if there is some contraindication for our treatments. It's extremely important, and also will allow us to be much more caution. At the time of initial evaluation, it's when we're taking history, we're asking questions. We're asking questions additionally that we will do for patients. And if a person will tell, you know what, I'm practicing 6 hours a day. And always in this case is before I touch. And this is what happened right now, injury, I cannot practice. I asking if any rehabilitated effort from this vigorous exercise, side effects of exercise such as tension in muscles, tension in fascia, ever was applied to you. If not, I already know. I consider much more severe injury because all force which was applied, and because this person was preconditioned to injury, and in this case he couldn't avoid it. It was forced against him. But I know and I interpreted severeness much more significant. Why? Because he already before he was hit from rear, and because he practiced so much, his muscles is for sure, and because he never was rehabilitated from this side effects of vigorous exercise, his muscles demonstrated all over the body higher resting tone. Means it's already transmitted some strain to the tendons. And the fascia, for sure, of this years of practice and all these damages to the fascia, in fascia due to higher resting tone of muscles will accumulate tension due to metabolic insufficiency, will accumulate tension. Oh my goodness, and there is a lot of, I consider already, a lot of tears because of this force. A lot of, it's happened just when he practiced in running, and this why if somebody will be not rehabilitated from this vigorous exercise side effects, it happened every time this losing elasticity, partial fibers, tears of fascia muscles, and immediately attempt to glue it. It's adhesions. We call this adhesions. Happen, and this is kind of snowball. It's terrible. But these kind of preconditions have to be discovered if was. And of course, if elder people, like I said, we see as precondition is degenerative changes. It have to be considered. We have to be kind of emotional in full picture. Now, in physical methods of treatment, at the time of evaluation, we consider two factors, objectives and subjectives. Subjectives, very important to listen careful, and I will ask clients, what do you feel? Where is the pain? What do you feel at all? How are you sleeping? Don't forget if this is car accident or even sport-related and some young fellow or lady. It's a lot of stress and fear, the momentum, all this adrenaline rush, all this. We have to listen careful, and we have to ask all this question additionally to health history. This subjective information is extremely important. what do you feel, where, how. In many cases, I come to conclusions after evaluation that you see, to address real painful spots, it will be not really a right decision. Sometimes I decide a little bit protocol of orthopedic massage, that including lymphedema management. We have any trauma causing lymphedema, swelling, even not visual, inside we know. And we have, when I will demonstrate in details, I will explain. I will do lymphedema, but then I'll do a little bit stress management massage to calm down the person, his activities of autonomical nervous system, because if this will not come down and this fear will dominate and psychological trauma will dominate, and body and mind we cannot separate, will be very difficult to progress. Therefore, this subjectives that we're taking, this information what we're taking at the time of initial evaluation is extremely important. Details, and to listen careful. Objectives, this is what I feel. If I, okay, he reporting pain, neck, right side neck, upper back, and shoulder tingles in arm, right upper extremities. All he reported, and now I will start to see the objectives, and I will press against these muscles. And of course, if muscles not, I know already, he described what happened with them, and he in pain, but plus minus to see the tension of muscles. If muscles I compress, they have to, there's a soft tissue and elastic tissue, they have this range of own movement. If this just rigid, doesn't want to press back, it's a higher resting tone. Fascia, I will try to move fascia, to investigate fascia. And if this sticks, it give me a picture.